primary health care in Nigeria so that we can also improve the outcomes for life and living in our country. So thank you all for coming. Very quickly, I'll do the introductions and also get all of us to also be able to introduce ourselves in a moment. In the meantime, we also would like to alert our online audience to please make themselves available by means of introduction through the chat box. But for now, let me first of all invite the chair of the Nigeria UHC Forum to please say one huge and warm welcome to all of you. Ladies and gentlemen, the multiple award-winning High Chief, Mojisola Oluwa Makajuola.
Thank you so very much, our anchor for the day, Mr. Ayokanmi Osenlu. Since he called my name, I'm sure you don't know that Mojisi or Oreolua Mojisi, you know. Thank you so very much. I'd like to say a very, very, very warm welcome to all of you, my elders, my contemporaries, and also my juniors, and also all of us. What we are witnessing today is unique. What we want ab initio is that this administration has come, particularly in the health sector, has come with new things that will happen. And we need to know so that we can demand, we can make demands, we can also say to them when they are not meeting their promises, and we can also live through those points so that indeed health becomes a priority in Nigeria. And I'm going to be hopping on and off from here to other things, but I just want to say to us that we're not disturbed with numbers. We're disturbed with actionable things that will happen here today. For the first time, we're going to have the executive director of the National Primary Healthcare Development Agency come to speak to us, what he has for us, and how we also collectively can be part of this development. I want to particularly thank my brother from Yobe State who had to crisscross and just giving him a handshake. I know that he has a bit of temperature, but for the fact that this must continue is here. The lead for us, and the CSO who has consistently made himself available for what the voices of Nigerians can do in promoting healthcare delivery services, also here with us. He will introduce himself so that we get to know him better. Our mother, who also leads the National Health Advocate, is also here. So, and is a collective responsibility. My co-convener is here. But most importantly, we have people who have the interest of primary health care and options with the lead of options coming all the way from Kenya. Asante, she's also here with us. So it's a collection of people on the continent. This is a continental thing that are ready to be part of what will happen today. I want to welcome all of us, including welcoming myself. I'm excited about today. I know that we will come up with actionable points that will fast track what National Primary Healthcare Development Agency will cascade to everyone so that together we can move healthcare sector faster, forward, and improved. I thank you so much. We would go around like the MC has said. I'm not MC today, so I'm very excited. I'm handing over the baton to him, and I'm sure that we would all have a wonderful time. Please make it very interactive because that's what it's meant to be. God bless you, and thank you for being here.
Thank you very much. the chair of the Nigeria UHC Forum, Chief Mrs. Mojima Kanjuola. Ladies and gentlemen, we will have self-introductions around the tables, but there are three actually of our guests, four actually of our guests that I crave your permission to quickly introduce to you. Beginning with this gentleman. In 2003, I arrived Abuja to serve as the Chief Press Secretary to the Honorable Minister of Health. So I operated in the minister's office, but across the corridor from the minister's office was this other gentleman whom you couldn't fail to notice. He was young, he was handsome, he was dashing, and he had a swagger that suggested that he had something to do with America. And of course, I would ask, who is this gentleman on the other? And they would say, the man is just called. And the man is a deputy director of planning, research, and statistics at the Federal Ministry of Health. He eventually, by the grace of God, moved on to be the chief executive secretary of the National Health Insurance Scheme, as he then was, and ultimately as a commissioner at the Independent National Electoral Commission. Just about 2 weeks back, we had the honor to gather together somewhere in the city for a huge party to celebrate his 70th birthday. He has remained an active leader in providing support for efforts in the health care industry to strengthen the hands of government and institutions to provide better health care for our people. Ladies and gentlemen, my very great honor every time. And so again this morning, my great honor as well to introduce the evergreen, the irrepressible, the irreplaceable, Dr. Mohammed Mustafa Lekki. Dr. Lekki is a high chief of the Auchi Sacred Kingdom. Specifically, he's the Galadima of Auchi. Thank you, sir, for joining us. And thank you for all that you do all the time. We appreciate your continuing contributions to building a better, more vibrant, more productive health system for the country. Quickly also, I'd like to introduce to you another very tremendous guest of this event, someone we are delighted to have by reason of the quality of contributions we know we will receive from her as we put ideas together to revitalize primary health care in our country. Ladies and gentlemen, she is a public health expert and a multiple award winner. She retired from the National Correctional Service as a Deputy Comptroller General, and today she is the chairman of the National Advocates for Health, an NGO supporting the health system significantly across and around the country. Ladies and gentlemen, I present to you Dr. Ekpedeme Udom. Also, we have in the house this morning the co-convener of the Nigeria UHC Forum. Basically a medical doctor, yes, but also, perhaps more importantly, a health activist. He's a system promoter, a system crusader, and he's led quite a number of initiatives around the country to support our institutions to build capacity and ability to deliver effective service, which will translate ultimately to better outcomes for the people of Nigeria. Ladies and gentlemen, Dr. Gafar Alawode. Dr. Chief Gafar Alawode, as a matter of fact. So the way it's looking now, you may need to be a chief to have to be on that table. So we have to carry out a review. If you're not a chief, then we will make an arrangement and then move you to another. Dr. Udom, I hope you will pass that hurdle. Oh, fantastic. Welcome, please. Thank you very much. Dr. Gafar is the big shot at the DGI Consult. Thank you, sir, for your work all the time. Lucia and I met this morning, but already we established common grounds, which is around the reality of Kenya. She's Kenyan, and I just told her that I was in Kenya a couple of years back for an activity for a week, and we shared beautiful stories of Nairobi. And then she's here today. She's the country rep of country director. How do you describe it? Project director of the Mamaye project here in Nigeria. Lucia, thank you for joining us. Welcome very much. Thank you. Now, my name is Ayo Osilu. I retired just last year as a director at the National Health Insurance Authority, NHIA, but I've also had the privilege to serve as a Chief Press Secretary to the Minister of Health, as well as SA Media to the President at the Aso Rock Villa. Today, I am with you as an advocate for health. I was on the list in Dr. Udom's platform so that I can also share your energy. Thank you very much for coming this morning. God bless you all. So let's now have an introduction of ourselves around the table, please. We'll just begin from, let's have a vote. Where do we begin from, left or right? Okay, left. Thank you. Oh, okay, please come, sir. Just before we take the introductions, my friend here is, okay, sorry, he will introduce himself. He's an official of the Continental Hotel, the premise of this event where we are located at this moment. It's a tradition of the system here to share some security tips with people who come into the system for an event, you know, so that, God forbid, emergencies, but if there's something and we need an urgent evacuation, we know what to do, we know where to go. Thank you.
Thank you, sir. Good morning, all. You're welcome to Abuja Continental Hotel, the safest, secured, and the most conducive event center in Abuja. My name is Saleh Mohammed. I'm the hotel safety manager. As Oga rightly said, it is our tradition here to tell participants of all events the safety and security guide, so that while you are here, we will not record any incident that relate to safety or security. However, before I continue, if there's a need for you to use the convenience, it's very easy to locate. If you just walk out of this door, turn to your right. Just go straight down there before the exit door. You'll see the convenience to the left-hand side. The first door is for the female convenience, while the second door is for the male. Please, you are advised to look before you enter, so that you don't enter wrong place. Aside that, today is not scheduled for a fire drill. Therefore, if there's a steady ringing of fire alarm bell for 2 to 3 minutes or beyond that, that suggests that something might have gone wrong somewhere or it's a false alarm. However, whatsoever the reason may be, please don't be panic. Be calm, because we have certified emergency response team members who must always act promptly should something go contrary to our expectation. If evacuation becomes necessary, we have 2 assembly points. 1, if you exit the entire Ladikwali Hall, turn to your left, you see an assembly point there with a signage. You are expected to assemble based on your group, because we have other people having their own function here. If assembling will not be there for whatsoever reason, you are advised to go to our secondary assembly point by using any of the exit doors I'm pointing, When you walk out through, turn to your left, you see a directional sign that will take you to the secondary assembly point. Then on the security aspect, please, this is a public place, though it's a controlled environment. It is very, very necessary that our personal valuable belonging, more especially our mobile set, laptop, and for the ladies, their bags should not be left unattended. It is not just applicable to this place, it's a global best practice, please, so that one will not see you or somebody may not use opportunity and do the unwanted. This takes me to the last stage. Saying this does not mean that the place is not safe and secure. No. We now have 2 advices for some of the attendees. Please, if you know you are not here for this program, you are advised to meet the organizers, to register you, or you take a bow and leave. Because the current security architecture of this hall will not be favorable for you. We will certainly detect you. We parade you for others to see you before we hand you over to appropriate law enforcement agent. Please be guarded so that you not feel embarrassed later. On behalf of the management, I wish you a successful program. Thank you so much.
Thank you very much. I hope we will find the hints as given very helpful in the course of this exercise. Thank you. So we'll start with our self-introductions. Thank you.
Good morning, everyone. My name is Samuel Aliu. I work with eHealth Africa.
Good morning, all. I'm Comrade Nadine Isa Dalatu, a member from Pan-African Mama Collective, Yobe State.
Good morning, everyone. My name is Isiri Adulo. I work with APT Global on the USAID NHSS project. Thank you.
My name is Dr. Bayo Madinekon. I work with APT Global on the USAID NHSS project. Good morning, everyone.
Good morning, colleagues. My name is Dr. Eduardo Celades. I am the Chief of Health of UNICEF. Nice to be here with you today. Thank you.
Good morning, everyone. My name is Zipporah Karu. Harris Hill Solicitors.
Good morning, everyone. My name is Batna Ayuba. I work with the Institute of Human Virology, Nigeria. Thank you.
Good morning, everyone. My name is Stephanie Okpere. I lead the Digital Health Division at Co-Creation Hub.
Good morning, everyone. I'm Iso Precious Amaka. I work with Orexin Consulting.
Good morning, everyone. Abdullahi Lawal is my name. Board Treasurer, Mamai Africa Collective.
Yeah, good morning, all. My name is Raju Garba, Board Member, African Collective.
Good morning. My name is Pauline Wasa from Kenya, Mamai Collective.
Good morning, everyone. My name is Okeke Ngozi. I work for Plan International Nigeria.
Good morning, everyone. My name is Dr. Hafiz Saidu Yaro. I work with Pathfinder International.
Good morning, everyone. Linda Ogalai. I work with Health Workforce Management.
Good morning. My name is Evelyn Boa from Kenya. I am a member of the Mamai Collective Africa. Thank you.
Good morning, everyone. I'm Mariam Steven. I work with Life Skill Education Foundation.
Good morning, everyone. My name is Haji Asepia Mohammed. I represent Women in Trade in Agriculture, Awita.
Good morning, everyone. My name is Ayomide Pedro, representing Awita Women. Thank you.
Good morning, everyone. My name is Roslyn Yo, work with Budget Foundation Health System Unit. Thank you.
Good morning, everyone. My name is Pharmacist Fatima Mawale Usman and founder at Mawale Inclusive Health Foundation. Thank you.
Good morning, everyone. My name is Folashade Bamigoye. I'm also with the Mamai Africa Collective. Thank you.
Good morning, all. My name is Jojo Gola.
I work with Options based in Kenya.
Good morning, everyone. I'm Saadat Nasser. I work with R4D.
Good morning, everyone. My name is Christy Carlo, and I work with R4D.
Good morning, all. My name is Ceci Olutime, and I work with Clinton Health Access Initiative.
Good morning, everyone. My name is Tiana Alfa. I work with Gestra Global.
Good morning, everyone. My name is Annabelle Nwachukwu. I report for Radio Nigeria.
Good morning, all. My name is Kingsley Sada. I work with ARCM.
Good morning, all. My name is Araji Kal. I work for Palladium.
Good morning, everyone. My name is Lulia Bob Manuel with Idmibok International.
Good morning, everyone. Emmanuel Efyong, ACIOE Associate.
Good morning, everyone. My name is Abubakar Suleiman. I work with DGI Consult. Thank you.
Good morning, all. My name is Ismail Abdrazak. I work with DGI Consult. Thank you.
Good morning, everyone. My name is Esther Ojo with DGI Consult.
Good morning, everyone. I'm Sekina Sanusi. I work with the Nigeria AC Forum Secretariat. Thank you.
Good morning, everyone. My name is Afolabi Okpemiko from DGI Consult. Thank you.
Good morning, all. My name is Peter Keme, the Vice Chair, Mama Air Africa Collective.
Good morning, everyone. My name is Ese Osa. I work with the medical department in Nigeria Railway.
Good morning, everyone. My name is Abdulkadir Mohammed Mustafa, a member of African Collective.
Good morning, everyone. My name is Salis Yusuf, board member, Africa Mamayu Collective.
Good morning, everyone. Noura Garba, board chairperson, Mamayu Africa Collective.
Good morning, everyone. My name is Elizabeth Onyango from Kenya, the board secretary to Mama Africa Collective.
Good morning, everyone. I am Paul Isiugo. I work with Social Capital Impact Group. Thank you.
Good morning, all. My name is Toyin Adebayo, Daily Independent Newspapers. Thank you.
Good morning, everyone. My name is Lawal Olalekan from Silverbird.
Good morning. Delian of is my name. I am with the Nation newspapers.
Good morning, everyone. My name is Tunde Onomusi, Carousel Solicitors.
Good morning, everyone. Remy Adeleke is the name, National Primary Healthcare Development Agency.
Good morning, everyone. James Vasumu Jacob is my name from Adamawa State Primary Care Development Agency.
Good morning, everyone. My name is Ona Samuel, Middle Age Global Tech.
Hi, everyone. Good morning. My name is Kingsley Chikwendu. I represent Media Age.
Good morning to you. My name is Sunday Archer of Life Skills Education Foundation.
Good morning, everyone. My name is Dr. Abubakar Hamza from Hikima Community Mobilization and Development Initiative. Thank you.
Good morning, everyone. I am Leshi James Bagauda, Premium Times.
Hello, everyone, and good morning. My name is Arinze Ajogu. I work with Social Capital Impact Group. Thank you.
Good morning, everyone. My name is Rachel Ogulano, and I work for IPAS. Thank you.
Good morning, everyone. Uthman Alao is my name. I work as the product lead at Tracker.
Good morning, everyone. My name is Hawa Abbas from Silver Lining for the Media Initiative, NGO.
Morning, everyone.
I'm here representing both the Nigerian USC Forum and the Health Sector Reform Coalition.
Good morning, everyone. My name is Nas Aisha Oshalza from Silver Lining Ordinary Initiative.
Good morning, everyone. My name is Ikwa, work with USAID in Nigeria.
Good morning, everyone. The name is Kenneth Okoineme. I work with Society for Family Health.
Good morning. My name is Dayer Mahmoud Yusuf. I work with Society for Family Health.
Well, thank you very much, ladies and gentlemen. It's a multi-stakeholder platform, and the objective is to harness the resources of everyone in the room and every organization represented in the room in terms of the competencies and the skills, as well as the benefits of the exposure and the experiences that each and all of us have brought to this room today. And then ultimately, the idea is to channel these into building a robust action plan that can help the Primary Healthcare Development Agency of Nigeria to execute its mandate with greater efficiency and with better outcomes. Incidentally, I'd like to let you know that this forum today is supported by Options Consultancy Services, whose lead friend and brother, Dr. Ufoma Omobi, is already here in the hall to be a part of proceedings here this morning. Dr. Omobi, welcome and thank you for your efforts. Yep. Thank you very much. Now, quickly, we would receive a series of goodwill messages that we have been directed to peg at 2 minutes per head, 2 minutes per speaker. Any speaker who exceeds 2 minutes will be surcharged, and we'll know how to make the bills available. But I'm sure we wouldn't have to do that ultimately. So please, 2 minutes per speaker. And we'll begin to receive these goodwill messages by one from the Executive Secretary of the Yobe State Primary Healthcare Development Agency, Dr. Babagana. Microphone, please. Or you'll come here. Please come. Thank you.
Thank you very much. Thank you. Thank you. Good morning, everyone. My name is Dr. Babagana Kundimachina, Executive Secretary, Yobe State Primary Healthcare Board, and the Secretary of the Forum of Executive Secretaries of State Primary Healthcare Boards of Nigeria, representing my chairman, Dr. Mohamed Osman Addis. I bring you the goodwill of the Forum of Executive Secretaries of the Primary Healthcare Boards and Agencies of Nigeria. We identified strongly with this laudable initiative of harnessing government and non-governmental resources and goodwill towards enhancing universal healthcare coverage in Nigeria, especially through strengthening of the primary healthcare space, which, as rightly pointed out by earlier speakers, is the entry point of the health system and has the capacity and the potential of meeting at least 80% of the health needs of the population if properly resourced and managed. On our part, as the chief executives of the state primary healthcare boards of the 36 states and the FCT, we are committed to ensuring that we key into the broader vision of the executive director and CEO NPHCDA, Dr. Muyi Aino, and the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohamed Ali Pati, and his team, of ensuring that not only are we advocating for and mobilizing more resources for PHC, but that we ensure that each resource that is so obtained and applied to the PHC system yields the dividend that is desired, which is actually producing more health or better health for the population of Nigeria. This will ensure holding our teams accountable for result, and also accountable for the resources that are entrusted in their care. We are ready to ensure that, as the Honorable Coordinating Minister has actually started, starting from last month, the quarterly performance review meetings, we have already started implementing that in our states. We are mirroring what is happening at the national level to start holding our PSC directors and other subnational stakeholders within our own sphere of influence, responsible and accountable for achieving results. It is no longer business as usual or in an era that previously, people will just be looking at inputs. We have done X number of meetings, we have just done X number of engagements, we have done X number of antenatal care or facility deliveries. We want to see what is the outcome. After having done all of those things, what is the outcome? Are we seeing fewer maternal deaths? Are we seeing better child survival? Are we bringing down the trajectory on under 5 mortality in the country? These are the results that we are holding ourselves accountable to and for which we make a commitment to do our best. Thank you.
Thank you very much, Dr. Babagana, Executive Secretary of the Yobe State Primary Healthcare Development Agency. He had just spoken for the Committee of Heads of State Primary Healthcare Development Agencies and Boards across the country. And he says, time is here to shift focus and attention from efforts to results. Efforts to results, from resources to outcomes. Thank you very much, sir. I said moments ago that this event is supported by the Options Consultancy Services. The Regional Director of Options, Dr. Ufoma Amobi, is here. Please, shall we take your goodwill message? Thank you. Yes, now. Thank you very much.
I thought you'd be putting your hands together for yourself for making it here this morning. Yes, good morning. You need to see this view. It's so amazing. I want to welcome you to this event. I'm really delighted to be with you this morning. I think I don't have a lot to say than to re-echo the sentiments of the chairman of the Committee of State Primary Healthcare Management Boards or agencies in this republic. It's heartwarming to hear him speak so strongly about accountability. It's so heartwarming to hear him talk about results. And that is what this event is about. How do we look at results in under 5 mortality, in maternal mortality related issues, in the lens of all stakeholders involved in the conversation? Should result be defined by a certain, a certain space alone? Anything by the people should be with the people, for the people, and by the people. And that's what this event is about. How can we harness the collective energies? I tell people, maternal mortality and infant mortality hits individuals, each person and multi people, each one at a time. And so we need to give power to all stakeholders. We need to create that space where every stakeholder will really have that conversation, to also harvest that energies that is resident amongst all the stakeholders to forge a common front. Because between you and I, the woman who is pregnant doesn't want to die. The child that she gives birth to, she doesn't want to see that child die. And so we are all in this together. And that's what we are here today. How can we harness our collective strengths, our collective vibes? For those who are accountable at government level, for those who are accountable at implementation level, everyone here in the room, those of us who have the vision, those fantastic organizations with great visions, and community groups, and the individuals. So I want to say thank you for coming, and I do wish us a very fantastic conversation, and not conversations that will end just here, but that will galvanize us into action with clear results that will show 1 year from now, 2 years from now, a significant decline in maternal and infant mortality in this very warm Republic of us. Thank you very much.
Thank you very much, Dr. Ofoma Omobi, Regional Director, Options Consultancy Services. It's all about harnessing our efforts for results. Full stop. Everything else around that is grammar. That's the bottom line. That's the purpose of this assembly. And that should be the new purpose of governance in our land. Results, results, results. We spent $1 billion. That's not the issue. Where are the results? We have a fantastic strategic direction. That is grammar. Where is the result? We should begin to demand results in Nigeria. Thank you very much, Dr. Ofoma. God bless you. Quickly now, shall we please hear from UNICEF? So, Dr. Eduardo, thank you.
Very few people clapping. Thank you very much. Let me just observe all the protocols have been observed. Thank you very much, Dr. Ofoma. Thank you very much, Dr. Gafar, for the invite to UNICEF to be here today with you. I'm really impressed with the number of stakeholders, the quality of the people that they have been invited here today. Really impressive to see so many people, so many stakeholders in this consultation and engagement. I'm really impressed as well to see so many people from Kenya. I think Kenya has amazing experiences on universal health coverage and the reform that they did at county level on that. So it's something that we need to learn and to scale up. Right? In Kenya, they have 1.2 million children per year. Here we have 8.5 million children that they need services. And that's one of the main challenges that we are going to face with universal health coverage. I have only like 2 remarks maybe to do. The first one is like Nigeria has embarked under the leadership of the Coordinating Minister of Health, Mohamed Ali Pate, in one of the most ambitious reforms of the health sector in the continent. It's not because of the sector-wide approach alone. Other countries have sector-wide approaches. They have one conversation, one plan, one money framework, and one budget. But it's about the scale, the scope, and the ambition, right? We are talking about a swap that is going to bring between $1.5 billion for 3 years to $3 billion, right? So this is a massive ambition. It's a massive reform. And how this is going to result in universal health coverage. And you guys, all of you are very familiar with the famous cube of universal health coverage. Who is covered with which services at which cost? So this is the thing that we collectively, we need to support the Federal Ministry of Health and the states to decide and to ensure that inequities are addressed. So we were hearing from Ofoma the issues with maternal mortality, with under 5 mortality. 1 out of 10 children are going to die before the age of 5 years old. Newborn mortality in Nigeria has not improved in the last 10 years. Maternal mortality is extremely high. We are seeing massive inequities, right? We are the country in the world with more zero-dose children, the one that they don't have a single shot of vaccine, more than India, for example. In places like Sokoto, still the Penta 3 coverage is 11%. Only 1 out of 10 children are vaccinated against Penta. So I think inequities should be one of the key parts of this discussion. The other one, we were hearing here from the chairman today, the emphasis on results. And I think there is somehow, I don't know if a tension, but there's a dichotomy sometimes between reforms and results. But we should be able to put that together, right? We have the long-term results, but as well we have the short-term, the long-term reforms, sorry, but the short-term results. And the country has achieved amazing achievements this year. 7.2 million girls were vaccinated against HPV. But still, we have polio, we have zero dose, no progress in newborn mortality. So we need to be able to put these 2 things together. So my appeal to you guys today is like, please do a bottom-up approach. I saw like a lot of civil societies here. please put the communities in the center on your discussion. So don't do a top-down approach of what needs to be done, but just, I hope that you're bringing the collective views of the communities to this discussion. So that will be my first appeal to you. And the second one, be ambitious. So be ambitious in your suggestions and your discussions. Be realistic, but be ambitious. A country like Nigeria, there is no limit for what Nigeria can achieve. So let's put in the table as much as we want to happen, and collectively we'll be advocating and influencing government and partners to make it happen. Have a great discussions today.
Thank you very much, Dr. Eduardo. And so today, UNICEF is charging us in this forum to please raise the bar of our expectations, raise the bar of our ambition. We're huge enough to do it if we set our mind to do it. Thank you very much. Now, I'd like to please invite Dr. Ekpedeme Udom to please speak her goodwill to this event and to inspire the objectives of this forum, which is to harness the multi-stakeholder energy in Nigeria for the improvement of primary healthcare. Can we please just very warmly welcome her? I can spare you the staircase and bring you. You can have the microphone, please. We had a mic with the gentleman here just now. Okay, if you can. Okay. Thank you. Okay.
Good morning, everyone. Today is a day that I'm so glad. So I'm not going to bother with protocols. I just like what the last speaker said. When the introduction was being made, I was so happy to hear the stakeholders that has been invited to this occasion. Because the first thing is the choice of stakeholders. If we don't have the right stakeholders, we are not going to be able to harness our strength. So we have the right stakeholders. And just now, I found out that Kenya is here because they've got a very good working universal health coverage, which is good that we can follow. So I am indeed happy because I know we're going to harness our strength. We're not going to be walking. We're going to be leaping. People in Nigeria, the time has come. If we don't have universal health coverage in Nigeria, if we don't have at least 60% coverage within the next 2 years, Nigeria is going to implode. And I'm sure we're not going to want Nigeria to implode. We have to work together. We have to jump together. We have to dream together to ensure whatever it takes that we have universal health coverage. And today is the first day of that journey because it's going to be a journey. So I want to thank the Nigerian Universal Health Coverage Forum, which I'm a member, and the National Primary Healthcare Development Agency, which we must work. Because I'm now retired and in my village, the primary healthcare center belongs to rats and cockroaches. And we're going to together move the rats and cockroaches out. Put the right people, the queues and all. Work together with the community. Ensure that the people have ownership of this primary healthcare and it will work. We can do it. It's not rocket science. We have started today. Thank you.
Thank you very much, Dr. Ekpedeme Udom, the chairman of the National Advocates for Health and retired Deputy Comptroller General of the Nigeria Correctional Service. Thank you for joining us. And I wish to say that one sure thing that Dr. Ekpedeme referred to this morning here is the reality of the very broad spectrum of the stakeholders that are present here this morning. That is very significant and very fundamental. It just simply shows that there is a alertness around the country about the need to do more and the need to do better. So please, can you put hands together for yourselves for making it here this morning? Thank you very much, everyone. Thank you. Thank you very much. Just while we were at it, thank you very much. We will just quickly acknowledge the arrival of the Executive Director and CEO of the National Primary Healthcare Development Agency. Ladies and gentlemen, I want to please give to you Dr. Muyi Aina. Thank you, sir, for joining us. Great pleasure to have you here. Thank you. Now, for the last piece of goodwill message, I'd like to invite Mr. Sidney Sampson, the CEO of Sidani Group. Can you please quickly, sir? Thank you, yes. Yep.
Thank you. Good morning, everyone. The EDCEU NPHCDA, good morning. Good morning, colleagues. It's a pleasure to be here today. And like other speakers have mentioned, this is a great event, and it's good to see the outing that has come out to discuss how we can advance UHC in Nigeria. One thing that has come out clearly from all of the conversations is that we want results. Dr. Eduardo mentioned that over the last 10 years, maternal mortality has not improved the way it should. Dr. Foma mentioned also how things have not improved the way we expected to. And there have been a lot of reforms in the last many years. And we know now that the government is putting in a lot of efforts to change things for the better. And what we are discussing is how we will support the government, put our hands together, and advance UHC in Nigeria. We want our mothers, our sisters to be able to give birth and do that safely without fear of death or fear of, severe injuries. We want our children to grow up in good health. And for us, one thing that I like about the conversations we'll be having here today is how we And I'm happy that we are here at Sidani to put hands with all of the partners, the donors that are here, with the government at the lead, to ensure that the efforts and the aspirations that the government has set will actually be achieved. We know that Nigeria is a big country, it's a complex country, but we know that we have the right team at the helm of affairs in government to drive things. We have the SWAP, we have the health sector reform agenda, we have the primary healthcare blueprint, all that have been put forward with a lot of thought and input from partners